wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. I want to visit with you about regenerative joint therapy. You know, the traditional treatment of joint pain is nonsteroidal anti-inflammatories like ibuprofen, Advil. Oftentimes when you have joint pain, you may end up going to the physician and they may give you an injection of cortisone in your joint. And these are not long-term solutions, and they're really not healthy solutions. Interestingly enough, both cortisone and the nonsteroidal anti-inflammatories like ibuprofen and Advil prevent new cartilage from forming in the joint. And so you go in for a joint injection, lasts a few months, and then it goes away. You go back for another injection, maybe a third injection at the end of the year, and then the doctor says, well, the joint's so bad, it's not responding anymore to the cortisone. Well, it's not going to. It's not going to make new cartilage. And so you're going to continue to have the degenerative changes within your joints, whether that's the knees, hips, shoulders, or any other joint. And these medications prevent new cartilage from forming. So invariably, you're going to get worse and worse and worse over time. And then ultimately, your doctor will say, I think you need a joint replacement. And joint replacements don't come without significant side effects. One, you go through the surgery, and there's always morbidity and mortality associated with any surgery that's done on anybody, no matter what it is, even in joint surgery. There is a percentage of morbidity, and that means increased sickness. I have a good friend of mine that had his right joint replaced, and he had to have it replaced a second time, and he developed a secondary infection. He had 3 different surgeries on his right knee, and it still doesn't work right. Now, there are some joint replacements that people are very satisfied with, but the problem is there's a long time to get it right, for the body to heal itself. It takes months and months and months. You have to go through a tremendous amount of physical therapy. And what I think is a better plan is to try to heal the joint naturally. Now, how is that done? Well, God's given your body amazing restorative powers to heal itself, and within our body we have molecules, proteins, that can promote healing in the body. And what we do in our office for people that have joint pain, and it all depends upon the severity of the joint degeneration. Some people have very minimal, some have mild, some have moderate, some have severe joint pain that they've had for years, and they've got bone on bone. And what we do is we draw the blood and we spin the blood, and the blood separates. The bottom of the tube has the red cells, the white cells in it. The top has the plasma. And we take the plasma, the supernate, off, and we filter that out so we can get a molecule called alpha-2 macroglobulin. And that alpha-2 macroglobulin is produced by the liver. It's a large molecule. That's what macro means, large. It's a large globulin, the type of protein. That particular protein is very helpful in the healing process, but because it's such a large molecule, it can't get into the joints itself. So when we take the plasma, we filter it, and we take off the alpha-2 macroglobulin, and we inject that into the joint, preceded by ozone, which is oxygen, O3. And what the alpha-2 macroglobulin does, it gloms onto the proteases and the catalases. These are enzymes within your joint that are produced by the immune system. They're inflammatory, and they eat away at the cartilage of the joint. And we want to stop that destruction of the joint. Think of your cartilage as a garden. And if you have a beautiful garden, go out one day and you got bugs eating in your garden, you got to kill the bugs first before you fertilize the garden and get it going again. And that's what the alpha-2 macroglobulin does. It inhibits, it binds these catalases and proteases and stops the inflammation. Then we come back in, depending upon the resolution. The more severe the problem with your arthritis, there's a possibility that you need a second injection of that 6 weeks later, of the alpha-2 macroglobulin, which we call A2M. And then we come back and after 6 weeks after the alpha-2 macroglobulin, we give you an injection of either Wharton's jelly, or we give you, which comes from full-term deliveries given by cesarean section, and they take a piece of the umbilical cord and they cultivate that, and that has exosomes in it. Exosomes are the chemicals and the proteins made by the stem cells that will promote healing of the cartilage. Or we can take the plasma and we spin it twice, and we get what is called super platelet-rich plasma. That also will stimulate new cartilage production within the knee. Now, as I mentioned to you, with surgery, there's a tremendous long-term amount of recovery time. Whereas when we do the injection in the joint with the A2M, you can walk out of the building the same day without a problem. And it takes several days to a couple of weeks to begin to have the reduction in the inflammation as the alpha-2 macroglobulin is binding up these proteins. And again, it all depends upon the severity of your joints. The longer you've had the problem, the more likely it is you may need a second injection of A2M. And then we give the follow-up treatment with either the super-rich, platelet-rich plasma, or we give you Wharton's jelly. We could use stem cells. Our problem with taking stem cells, I like to use stem cells from your own body. And we can take those and we can send them to a lab and have them grown out into hundreds of millions of stem cells and give that. The cost differential, though, is dramatic. It's 4 times more expensive to use the stem cells than it is to use your own body's fluids, and that would be the A2M and then the super-rich, platelet-rich plasma, or the Wharton's jelly. And so how long will results last? Well, they may last several months, they may last several years, and it all depends upon the degree of the joint problem. Invariably, your joints are going to be improved over where they were, and you may be able to put off or totally avoid the need for a joint replacement. It's safe because we're using your own body's proteins, your own body's fluids, and so there's no problem with the reaction to that. What must be done to determine the severity of your joint problem is to have an MRI done, and we like to do it bilaterally. If you have one knee that's hurt, we do both knees because oftentimes the other knee is also developing a similar problem, and we can do an injection for a minimal amount more. We can do an injection of both knees to help or the hip joints, or whether it's in the shoulder, we can help heal the joint and prevent it from becoming like the joint that's causing you problems. I like to remind people of this. We learned it in grade school that the hip bone's connected to the thigh bone's connected to the knee bone's connected to the leg bone's connected to the ankle to the foot, and that goes all the other direction. You know, your hips are connected to the pelvis is connected to the backbone, and all the way up your spine. So if you have a problem in one of your joints, it often can be due to an imbalance in your spine. I use chiropractic here and believe in that. I think that's important. Or it could be due to an old injury. That's very common. We see that particularly in men that played football. They commonly have these problems as they get older. Could be those that do a lot of running, particularly people that do They're running marathons. This is a very common problem. I have a daughter who's a marathoner, and gosh, she's young, in her 40s, and her right knee gave out on her, and we had to inject her. And of course, we don't recommend going back to, this doesn't mean you can go back and do your marathons after that. You need to be prudent, and you need to take care of your joints. You don't want to wear them down at a young age and be a candidate then for a joint replacement in your 50s or 60s. So before we do anything, we always recommend getting an MRI. That's very, very important. And then we'll read that, and then we'll have you in for a consult, and we can take a look at your joint using ultrasound. When you come in, we can determine whether or not, by the MRI, whether you're a candidate for the procedure. When you come in for the procedure, your blood is drawn. It takes about an hour and a half to spin it and get it into the right form. So you'll be here an hour and a half in the reception area prior to the procedure. Once we get the material from the blood, then we go into the procedure room and we inject the joint using an ultrasound, guided ultrasound, to make sure we get it in the right location. So that's the long and the short of regenerative therapy. I think it's a prudent way for you to handle joint problems, at least initially. We want to do everything we can to help the body heal itself. And as I mentioned earlier, God's given the body amazing restorative power, and it will heal itself if given the right material to do that. And that's what we do with regenerative therapy. So if you have any questions about this, don't hesitate to give us a call here at the Hotze Health and Wellness Center, and we'll be glad to help you with that. And when you come in, we'll explain to you, we'll show you diagrams and explain the joints to you so you can understand exactly what's causing the problem and what we're intending to do. Thanks so much for joining me today. I'm Dr. Hotze.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.